Good evening, class. My name is Cherie Sims, and I am sharing with you my business plan for Helping Hands Healthcare Consulting Firm. This is a new consulting firm that focuses on financial and regulatory compliance for inpatient acute rehab hospitals in the state of Florida. It is fully owned and operated by its president and CEO. Consulting services offered by this firm include revenue cycle management, financial reporting, operations management, practice management, selection and implementation processes, CARF readiness for inpatient acute rehab hospitals of all sizes. Why choose a consulting firm? We collaborate with clients to create and implement strategies to help them resolve their challenges and achieve their goals efficiently, effectively, and professionally. We promote quality, continuous improvement, and encourage feedback through stakeholder engagement. We can offer performance sustainability through our review process. Due to the fast-paced environment of today's healthcare situation and the urgency of changes that are required to stay in compliance, businesses should have access to experts who can maximize profits and improve workflow processes to ensure the financial viability and longevity of their company. Organizations are struggling to meet the daily pressures to increase productivity and provide quality of care. Our mission is to provide clients with a team of healthcare professionals who combine up-to-date knowledge and practical experience to create effective solutions. Our vision is to be a respected firm within our community that delivers results. Helping Hands can assist in working with clients to resolve issues, reduce cost, improve cash flow, and implement best practice protocols. Each consulting service is tailored to the individual needs of the organization. Whether it be patient access and flow, physician productivity, physician satisfaction, reimbursement issues or reporting, we have the experience and ability to provide answers for your organization. We also offer services to expand your inpatient rehab facility program. Our services would provide marketing strategies through physician and staff education, revenue cycle management, strategic planning, and probability analysis. Healthcare organizations and providers must adapt in this technology-driven world, and our consulting firm can assist in those integrations. In addition, we help facilities meet the CMS guidelines for IRFs and meet national benchmarks. As the owner-operator of the consulting services, I bring over 20 years of experience in administration and healthcare industries, specializing in inpatient acute rehab, regulatory compliance, and commission on accreditation of rehabilitation facilities, also known as CARF, C-A-R-F. I have completed my BS in Healthcare Management and have a Master's in Healthcare Administration. The competitive environment in Southwest Florida is minimal. In the state of Florida, according to the U.S. News and Best Ranking Hospitals, there are 58 rehab hospital facilities. There are many consultants within a 100-mile radius of Southwest Florida, but very few that offer rehab-specific expertise. Healthcare is very complex, and the laws and regulations change often, especially for inpatient acute rehab facilities. As we embark upon the PPS proposed rule changes for fiscal year 2022, our reimbursement rates will increase as well as the case mix classification system. Therefore, healthcare organizations and providers must adapt. Many healthcare consulting firms focus only on practice management or provider services. The sole focus of this firm is inpatient rehabilitation facilities, compliance, and accreditation for CARF. With the average Medicare reimbursement rate per IRF patient being $18,934, and the average annual admissions per facility is around $750. It is vital for the growth and success of rehab facilities to be engaged in strategic planning. Our firm will focus on strategic management, financial management, information technology, process and logistics, and marketing. The healthcare services market is a $50+ billion industry and continues to grow exponentially without any signs of slowing down. Share in this success marketing strategy shows the expertise level of firm as well as new and innovative marketing strategies that focus on social media platforms and web search capabilities. The Helping Hand social media page will embrace a new front office structure, marketing, sales, and service executives who seek advice with new processes and policies. Leadership staff capabilities and skills that address the 6 must-haves: data, analytics, automation, organizational structure, metrics, and culture. In addition, our firm would focus on CARF accreditation for inpatient rehab facilities. CARF accreditation can help your organization meet the challenges it faces in achieving quality outcomes for the persons you serve. We would offer our services prior to a CARF survey and ensure facilities are meeting the standards and compliance regulations. Healthcare consultants help facilities make sense of healthcare economics. These limitations can make it harder to provide excellent medical care that produce understanding results. Healthcare consultants make accomplishing this objective easier, conveying their insightful abilities to work on a facility's financial health, such as some of the areas we have achieved, being accredited since 2001, and discharge to community outcomes being well above national benchmarks. We aim to help inpatient acute rehab facilities understand CARF and the benefits of the accreditation. An organization receiving a 3-year accreditation has put itself through a rigorous peer review process. It has demonstrated to a team of surveyors during an on-site visit its commitment to offering programs and services that are measurable, accountable, and of the highest quality. CARF represents the highest level of accreditation that can be given to an organization and shows the organization's substantial conformance to the standards. Another service provided in our marketing strategy would be education for startup inpatient rehab facilities. Continued education for internal stakeholders regarding CMS requirements. Education to external stakeholders and referral sources regarding the benefit of an inpatient rehab facility versus a skilled nursing facility is vital to the growth and success, and we would share the rehab-specific differences. We will train in marketing strategies. This key initiative will allow for continued review and stakeholder trust. You will achieve greater clarity throughout your organization, higher efficiency, and more accurate communication and data sharing when you are able to engage stakeholders in your marketing strategies. One of the marketing strategies for our business is Committed to Excellence. It is a platform of telehealth advancement and process improvement initiatives. Some of the largest hospitals in Florida are growing their technology in telehealth advancements. The Mayo Clinic recently launched their Home Health Services telehealth program. Patients who need hospital care but are not sick enough to be in the hospital were sent home with monitoring devices for 30 days, and physicians did daily checkups and ensured they are progressing in the comfort of their own home, without having to put a strain on the hospital system during this time of crisis. As one physician stated, "I truly believe that over the next couple of years, it will be the expectation of patients." Helping Hands will be available for healthcare consulting services related to talk shows and interactive sessions on TV and radio. We will contact health executive teams and marketing directors to notify them of our services. We will list our business on local directories and magazines. We will create different packages and categories for potential clients. And we will also join the local Chamber of Commerce to aim at networking with other referral sources. Initially, Helping Hands will be a startup business with only my position as the owner-operator. However, over the next year, we will need to expand due to the projected clientele growth in the area. We will expand to a receptionist and a health information management position, which will allow us to review and submit CMS denial cases for reimbursement. Medicare cases that are denied medical necessity in an IRF require additional staff to submit throughout the various stages of an appeal. And our team has experience in recovering revenue for over 40 denial cases with a total revenue of over $100,000. The capital requirements and startup costs for this business will be low due to the size and scope of the initial business model. There will not be a separate office for the first year. The business will be operated out of the home of the business owner. We estimate $1,500 for business license and continued education certification. Attorney fees and liability insurance should cost approximately $3,000. Equipment startup, software programs, and miscellaneous office supplies and expenses should total around $2,500. Lastly, website development and advertisement through mailouts, radio, and local TV advertisements should cost us around $3,000. Therefore, the total expected investment for the first year will be approximately $10,000, and these funds will be allocated from our personal savings account for startup. Healthcare consultants are self-starters and quick learners who require minimal supervision. They need critical thinking, problem-solving, communication, and leadership skills. They need to be able to use a suite of different software systems and be able to provide decision, model, and big data analytics. Adaptness in management techniques such as Lean and Six Sigma can be a large benefit to healthcare consultants. The National Society of Certified Health Business Consultants offers the Certified Healthcare Business Consultant designation. In order to earn the credential, candidates will become members of the organization and then pass a 4-hour certification exam. The exam is designed for seasoned professionals and recommends candidates have several years of experience and membership before attempting it. The exam costs approximately $600 and must be renewed every 2 years through a completion of 50 continuing education hours. This is a role that requires continued education on best practices, government regulations, and emerging trends. To stay at the top of their field, many healthcare consultants will need to be lifelong learners. A master's degree is preferred for anyone looking to start a consulting firm in the area of specialization. In addition, healthcare consulting certifications are encouraged. I want to thank you for taking a few moments and reviewing my business plan, and I encourage you to partner with us to provide the best rehab option for your patient. Thank you from Helping Hands Healthcare Consulting Firm.